Original Medicare was never designed to cover every dollar. Because there's gaps, monetary gaps in Medicare, people get Medicare supplement policies to cover some of those gaps. I'm going to show you how Medicare Supplement Plan G fills the gaps of Medicare Part A and B. I'm Debbie Riskin. I work at GM Goldman & Associates, my family business, and we're independent agents specializing in Medicare insurance. How does Medicare Supplement Plan G fill in the monetary gaps of Medicare Part A and Medicare Part B? Before we get into the details, I want to give you a little framework. Medicare was first offered to Medicare beneficiaries in 1965. It consisted of Part A, hospital insurance, and Part B, medical insurance, hence Original Medicare. Original Medicare is managed by the Centers for Medicare and Medicaid Services, or CMS, and the way the system works is the doctor determines your medically necessary care. You get the care, the doctor submits the bill to CMS. It's their job to process the claim, determine if it's covered, and if yes, how much. They're going to pay Medicare's portion to the doctor, and then as you know, there's gaps in Medicare, so either you're going to pay the monetary gaps or you're going to get a Medicare supplement policy. Let's look at how Plan G fills in those monetary gaps. If you look at this chart, the first column, that tells you all the different benefits that a Medicare supplement or a Medigap, same thing, plan can offer. If you look to Plan F in the middle, it covers all the dollar gaps. If you look to the right, you look to the left, you can see the different plans and what they cover. Under Plan G, it is identical to F except for one benefit, the Part B deductible, which we'll get to. So let's start with how Plan G fills in the gaps of Part A. Part A is your hospitalization, semi-private room and board, general nursing, and miscellaneous services and supplies. It's measured by benefit periods instead of calendar years, which is something we can explain in a different video. But let's take a look. So whether you're in the hospital one night or up to 60, Medicare is going to pay the entire bill except for the Part A deductible of $1,556. But because you have Plan G, it's covered and you pay nothing. Now, with Part A, there also is a coinsurance. For days 1 through 60, there is no coinsurance, but for days 61 through 90, Medicare is going to pay the entire bill except for $389 a day. But because you have Plan G, it's covered and you pay nothing. For days 91 and thereafter, there's a whole explanation about lifetime reserve days, which is for a different discussion, but just understand that there is some coverage after day 90. Now, under Medicare Part A, there's also something called skilled nursing facility care. For days 1 through 20, there are no gaps. Medicare pays the entire bill. For days 21 through 100, a coinsurance kicks in of $194.50 a day, but because you have Plan G, it's covered and you pay nothing. Now, that doesn't mean they'll keep you 100 days, but you're eligible for 100 days. For days 101 and on, you're on your own. Medicare doesn't cover anything, neither does your supplement. Now let's talk about how Medicare Supplement Plan G fills the gaps of Medicare Part B. Medicare Part B is medical expenses in or out of the hospital and outpatient hospital treatment. That includes doctor services, inpatient, outpatient medical and surgical services, and supplies, various therapies, diagnostic tests, durable medical equipment, and so on. So let's take a look at this. Before Medicare is going to pay a dime of your doctor bills, there is a Part B deductible of $233. That is not covered by Medicare. That is not covered by your Supplement Plan G. That is paid by you. But once you've paid that $233, then Medicare is now on the hook for your doctor bills. Medicare is going to pay 80% of your bill generally. Your supplement is going to pick up the other 20%, which means you're going to pay nothing. There's a benefit called Part B excess charge that I want you to know about. There's a small group of doctors out there that don't accept assignment with Medicare, maybe 3 to 4% of the doctors out there. Those doctors can charge an extra 15% over the Medicare approved amount, but because you have Plan G, it's covered, you pay nothing. There's also foreign travel coverage with Medicare Supplement Plan G. Medicare does not cover any sort of emergency care outside the country, but Medicare Plan G does. So what happens is there's a deductible of $250 that is paid by you. Medicare Supplement Plan G does not cover it. But then once you've paid that, Medicare still pays nothing, but your supplement will pay 80% of a bill, and you're responsible for that 20%. And the most that a supplement will ever pay over a lifetime is $50,000. So let's just tie this all back in together. Medicare, what happens is that the doctor determines your care, they submit it to CMS, CMS processes the claim, and they pay their portion, and the supplement pays the balance. So here's a $1,000 bill, Medicare paid $800, supplement pays that 20%, the $200. One thing I want you to know about these Medicare supplement plans is they're standardized by law. What that means is this explanation that I gave you for Plan G is going to be the same for no matter which company you go to, because that keeps it really clear and easy to understand. But what you should know is that an insurance company can charge a different premium for the identical coverage. So let's say you have that $200 that's being covered by your Medicare supplement, but one company pays or charges $199 for premium and the other charges $143. So you want to know that when you're choosing a supplement, they can charge different premiums for identical coverage. So full circle to all this, how do you choose a Medicare supplement? You look at the benefits. Which ones do you want covered? We figure out which insurance companies sell that particular plan in your state, and then we help you compare the costs. If you're interested in help with Medicare, please go to our website at gmgoldman.com or reach out to us at our office at 847-675-3600. We're here to help. There's also a link in our bio.